Hello, everyone. It is a great honor to be here today, virtually at the 17th International Research Conference of KDU to present a topic that is vital for the future of scientific research, particularly in resource-constrained settings like ours. Enhancing research value and reducing research waste through the use of systematic reviews. First, I would like to acknowledge and pay my respects to all Aboriginal and Torres Strait Islander First Nations people from the area where I am presenting today. Within this plenary, I would like to walk you through why research waste is a problem, how can systematic reviews help us to address research waste, barriers in the Sri Lankan context when conducting systematic reviews, and some potential solutions. I am aware that we have a greater collection of scientific community today gathering at the 17th International Research Conference of KDU, and I hope we can come together to find some solutions to reduce the research waste in our motherland. So let me start with the study conducted in China by Yongxi and his colleagues. So these authors analyzed the impact of redundant or unnecessary randomized control trials evaluating the effect of statins in treating coronary artery disease. So redundant refers to something that is unnecessary because it repeats what has already been done, offering no additional value. So similarly, in this study, redundant refers to conducting a study that replicates previous research without adding new insight or findings. So we all know that clinical trials are essential for advancing medical knowledge and improving patient care. But when trials are redundant, they can waste valuable resources and, more worryingly, put patients at unnecessary risk of harm or even death. Let's see how this happens. So statins have already proven to be effective. Yet, over a period of 10 years that Yongxi's team had assessed, they found more than 2,000 unnecessary or redundant trials conducted to assess the effectiveness of statins, even though this was already well established. So in our series, there are typically two or more groups, right? So one group receives the statins while the other group receives a placebo or a control drug. So in this case, over 100,000 people in the control groups did not receive statins, meaning they missed out on the proven treatment for their condition. So as a result, the researchers found that many of those in the control groups experienced major cardiac events or even death because they were not treated with statins. Specifically, you can see there were like 600 deaths, 973 heart attacks, and 161 strokes among the control group participants. So these researchers unnecessarily put patients at risk of harm and death. And think about the other significant waste of resources as well, like including the time and effort of the researchers, time and effort of the participants, as well as the associated cost. For example, researchers' salaries and drug expenses related to RCTs. So the consequences of bad research can be tragic, both in terms of wasted resources and human lives. So reducing research waste is not just a matter of efficiency, but also an ethical imperative. Okay, so the research is the foundation of progress in health, medicine, and science. But we are facing a significant global challenge, research waste. We just had discussed an example now from Yang's study. So it is estimated that 85% of health research is wasted due to unavoidable errors, such as asking the wrong questions, using poor methodology, and disseminating results poorly. So this equates over 100 billions of dollars lost annually on studies that are either incomplete, poorly reported, or not applicable to decision making. In resources limited settings like Sri Lanka, these challenges are even more pronounced. The question we face today is how can we address this waste and maximize the value of research we conduct? The answer may lie in systematic reviews. So, researchers around the world are working hard to make research more valuable. And they're not just addressing redundancy, they are also tackling much bigger issues. Things like the large number of low quality studies, research that never gets published, and studies that can't be replicated. So to combat this, we have guidelines and checklists like Prisma and Strobe, or registration bodies like clinical trial registries and Prospero or OSF like systematic review or scoping review registries. And also, there's something called evidence-based research approach or EBR for short. The goal of EBR is to cut down on research waste and make sure we are doing meaningful work. It does this in two key ways. So, the first, by engaging the people who are actually going to use the research. These are the end users, for example, patients, GPs, students, policymakers, or even funders. So, by getting their input before, during, and after the study, we can make sure the research is more relevant and more impactful. And the second way is by looking at what is already been done. Before starting a new study, researchers need to review earlier work to see if their question has already been taken or not. So in Yongche's study we just discussed, if the researchers who conducted over those 2,000 redundant studies on statins, if they have like simply done a systematic review, they would have seen that statins were already proven to be effective. They could have spared over 3,000 patients from unnecessary risk of harm and saved countless of resources related to those redundant studies. Well, you know how significant systematic reviews or previous evidence can be. And there are many ways that people summarize or synthesize previous evidence. It could be like literature reviews, systematic reviews, evidence map, rapid reviews, integrative reviews, scoping reviews, or umbrella reviews. There are many. So out of these reviews, systematic reviews stand out as a powerful tool in this effort because of its more systematic and transparent methodology. And systematic reviews are defined as robust, reproducible, and structured critical synthesis of existing research, providing a high level of evidence for policymaking and clinical practice. The strength of systematic reviews lies in their ability to filter out low quality studies, synthesize available knowledge, and provide clear answers to important questions. So apart from the use of systematic reviews for their help to avoid duplicate research and highlight where more studies are needed, they also inform evidence-based decision making by summarizing what is already known. And they help to identify meaningful and important research gaps or important research questions for new research projects. And Yeah. So there are different types of systematic reviews as well. For their for example, they can address various research questions. But the most popular one or the common one is the effectiveness of review or interventional reviews, where it combine or collate the studies examining the effectiveness of interventions. So there are, qualitative reviews focus on patient experience and perceptions. Cost effectiveness reviews help allocate resources more efficiently for health research. And there are diagnostic accuracy reviews, for example, assessing the reliability of diagnostic tests, prognostic reviews, and there are many others like, etiology or risk reviews, expert opinion reviews, policy reviews, psychometric reviews, prognostic reviews, and methodological systematic reviews. So each type serves a distinct purpose, ensuring that the research findings can be tailored to specific needs. So in many countries like ours, researchers face significant challenges when it comes to conducting these type of systematic reviews. Challenges that often go unnoticed. And today, this conference may be a good place for us to think or rethink as researchers. So here we struggle with a lack of academic recognition, where systematic reviews are often undervalued within our institutions, undermining the efforts of researchers who strive for rigor and relevance. For example, one example is that I was asked by one of the higher degree proposal reviewer to remove systematic review as part of an MPL project that I supervised. Uh, don't get surprised. So coupled with this is limited access for resources, as many researchers do not have the necessary databases, full text paper access, and systematic review software. They it making it challenging to engage with the body of knowledge available. And also, there is a lack of expertise in systematic review methodologies, leading to insufficient training for researchers and consequently a struggle to conduct high quality reviews. So, these barriers not only slow the progress of research, but also make it harder to implement evidence based findings in our context. Okay, so how can we tackle these barriers together? We need a well rounded approach that starts with training and capacity building. Maybe by organizing workshops, seminars, and train the trainer programs, we can help the researchers, academic staff, librarians, and students to gain the systematic review skills that they need. It is also important to improve the access to resources. Maybe we should work to ensure our institutions have access to the electronic databases that we need, journals, and also systematic review managing software like Covidence or reference manager software like EndNote. And another important step is to incorporate systematic review skills into our curriculum effectively, and also making them a key part of higher degree programs, and also encouraging students to take them on in their dissertations as well. So we shouldn't forget the power of international collaborations as well. By building partnerships with institutions around the world, we can foster fellowships, training, and joint research in systematic reviews. So I would like to take this opportunity to invite the faculty educational units, academic boards and research committees, faculty libraries, systematic reviewers, and all researchers present here today to support these efforts by promoting systematic review culture within your universities or research institutions. And as a wrap up, I want to leave you this message from one of the Lancet editorials. Unnecessary and badly presented clinical research injures volunteers and patients as surely as any other form of bad medicine, as well as wasting resources and abusing the trust placed in investigators by their trial participants. Thank you.